When children are catastrophically injured, they need so much more than just damage awards many years ahead. Sometimes they immediately need medical services, treatment, placements, governmental benefits, and even special needs trusts to preserve those benefits so that we can help them throughout their lifetimes. At Justice for Kids, that's exactly what we do, and baby Angela is an example of the kind of work we have done for years. In 2002, I had the privilege of representing Angela Sozzani, who was a little foster child who had fallen into a pool on the day of a birthday party where, tragically, she nearly drowned and ended up in a hospital on a ventilator, feeding tubes, and brain injured to the point that she would never lead a normal life. My job was to try to recover enough money that we could fund her existence, her care, her treatment, the ability to give her what she needed for the rest of her life. The work just began because she was in the Florida dependency system, and I had the privilege of being her attorney at litem to ensure that she was placed in an appropriate facility that could address her healthcare needs. She wasn't walking, she wasn't talking. We didn't even know if Angela could feel pain at that time because she seemed semi-conscious. And so, even in the personal injury claim, when the defendants claim that she can't feel it, she doesn't have the ability to endure pain and suffering, we were concerned because we saw, as we moved her through the process of healing, that she was showing signs. After the personal injury settlement, the first significant legal battle that we had to endure was Medicaid wanted to move her out of the nursing facility. They wanted to put her into a group home that was nowhere near a hospital when she needed life support. It didn't have shift care 24/7. And if somebody went to sleep and Angela had a problem, there was no one there to address her needs. We were able to marshal the data together and fight Florida's Agency for Healthcare Administration and successfully resist the efforts to put her into a group home so the state of Florida could save money. Angela aged. It was more than 2 decades later, but she still needed us to participate in her dependency case till she turned 22 years old, because unfortunately Florida did not find her an adoptive family. And so the biggest battle we fought for Angela was just before she turned 22. We were able to do something that has almost never been done in the state of Florida. We were able to fight to get a waiver to keep her at the KIDZ KORNER. Now, KIDZ KORNER was a licensed facility. Their licensure level would not allow Angela to stay or any adult to come into the facility to receive the specialized kind of care that Angela received. But I can tell you this, Angela had improved over the years. Angela opened her eyes. Angela started to show us all that she was there. Angela's eyes would track us when we came into the room, and she would see us and we would know that she was attaching, because there were times we saw she would almost cry when we left, and she seemed to recognize us all when we came. And we made the argument to the Agency for Healthcare Administration, the top officials in the state of Florida, that after 20 years in foster care in the KIDZ KORNER facility, Angela deserved to stay at KIDZ KORNER, to be with her family, but care for her for most of the 20-year period of time. And fortunately, just before her 21st birthday, the Secretary of the Agency for Healthcare Administration in the state of Florida signed an order allowing Angela Sozzani to remain in the KIDZ KORNER, a pediatric care facility, for the rest of her life.